There's a new headline that's causing a lot of worry in the medical community when it comes to colon cancer. A recent New England Journal of Medicine article prompted widespread headlines saying that colonoscopies don't work. 9 News health expert Dr. Payal Kohli joins me, Chris Bianchi, to help debunk that faulty headline. Here's my full interview with Dr. Kohli. All right, Dr. Kohli, colon cancer, something, we've been so focused over the last couple of years, obviously with COVID, on different sorts of health things, but one obvious cancer that's one of the top killers in the United States and across the globe is colon cancer. Can you tell us a bit more about the state of colon cancer after the pandemic?
Chris, it's been really unfortunate. The pandemic has caused so many indirect impacts that we can't even start to measure. So colon cancer diagnoses fell by about 40% during the pandemic.
Wow.
And that's not because people weren't getting colon cancer, it's because it wasn't getting diagnosed. Because many of us missed many of our routine health screenings, including screenings for colon cancer, such as colonoscopies, because elective procedures were postponed and such. The other interesting trend we've seen in colon cancer in the recent few years that has really prompted a lot of change in the guidelines is that younger people are now dying more of colon cancer, whereas the older people are dying less. And the reason is because we had spent so much effort screening those 50 and above people with colonoscopies and saving their lives that we almost kind of missed the early onset colon cancer patients, the ones that were getting colon cancer before the age of 50. So because of these disturbing trends, actually the new guidelines now have moved the colon cancer screening age with colonoscopy down to 45. So we really need to start screening people earlier. And then if you have a family history or other risk factors for colon cancer that put you at higher risk, you maybe should talk to your doctor because you may even need to start screening earlier than 45.
What are the basic, you mentioned family history, what are some of the other things to watch for in terms of perhaps moving that age up a little bit?
So certain types of dietary patterns, so certain diets rich in red meat and low in fiber, those can put you at higher risk. Being obese can, smoking can do it as well. And then there's certain genetic mutations that if you have other types of cancers or carry this genetic mutation, that can put you at higher risk as well. But kind of the bottom line is if you have someone in your family who's a first or second degree relative who's had early onset colon cancer, then you maybe even want to start getting screened about 10 years before that person's colon cancer was diagnosed. So that's really how aggressive the Cancer Society guidelines want us to be when it comes to colon cancer screening, because the difference between early detection, which is cure, and late detection, which has a very poor prognosis, is literally life and death. And with colon cancer, because our colon is designed to hold our stool, and you could hide a mass in there and not realize it, for many, many years, and it can grow. And so if you snip that thing off when it's just a polyp, it's never going to turn into that big malignant mass. But if you never even looked, and it just sits in there, and then one day when you start having abdominal pain or you start having obstruction of your stool or some other symptoms and it gets diagnosed, by that point it's already grown too big.
So, question, we're going to get into a study here in just a second about colon cancer specifically, but does the fact that 40% less people were diagnosed, does that mean that there's a bit more late detection and unfortunately higher maybe death rates with colon cancer now?
That's really what we worry about. And we're still collecting the data on that to see if we're now diagnosing people later, now that we're sort of digging out from the pandemic. But based on some of the other cancers, we're seeing this in breast cancer and other cancers as well, we worry that that's exactly what's going to happen. And we didn't diagnose these cancers in the last 2 years. And depending on the type of colon cancer, a year or 2 years can really make a big difference between the stage of the cancer that you detect, the prognosis, the type of treatment that you're going to require, and your long-term longevity.
No doubt about that. Okay, so there's a specific study that we want to get into, and the unfortunate headline that seems to be taken away from it is that colonoscopies don't work or they're not as effective. What is your takeaway based on this study?
The opposite. Yeah. and I really want to debunk that because that is the headline. And a lot of chatter on social media about that the study from the New England Journal of Medicine tells us that colonoscopies don't work. So let's get into a little bit of the nuances of the study. But basically, the study invited a bunch of people, over 80,000 people, to either get a colonoscopy or do nothing. And then they counted up who basically lived and who got diagnosed with colon cancer. So really provocative study, because it's asking the question, this colonoscopy thing that we've been doing for so many years, is it actually saving lives and is it actually preventing colon cancer? So of the people they invited to do the colonoscopy, only 42% of them actually did it. So, a large majority, 58%, didn't actually end up getting the colonoscopy. So if you actually count the people who got the colonoscopy, who were invited and got the colonoscopy, we see a reduction in colon cancer diagnosis of 31% and a reduction in colon cancer death of 50%. So it's really dramatic numbers when you think about it. But if you lump everybody together, even the ones that didn't get it, the numbers didn't look as impressive. So I feel like the design of the study was really asking the question of, did an invitation to get a colonoscopy save lives or, prevent colon cancer? And the answer to that is probably not. But did the actual colonoscopy, for the ones that got it, prevent colon cancer or save lives? And the answer to that is a resounding yes. So I still very wholeheartedly recommend colonoscopy. It's the gold standard for screening. Now, hopefully, in the next 5 or 10 years, in our lifetime, as we start getting screened, they'll have more sophisticated, maybe non-invasive ways to start screening with their CT scans or other such things. And that might be nice. Then you don't have to do that prep for the colonoscopy. But today, it's the best way to get screened for colon cancer.
So what was essentially the point of that study there, if that's the takeaway that came from it?
Well, so, when we do a clinical trial, sometimes to prevent introduction of bias, we have to count the person in the arm they were assigned to, whether they took the treatment or not. And that's called an intention to treat. So if they got assigned, to the colonoscopy arm, whether they got the colonoscopy or not, to be really clean in how we do our statistical analysis, we have to count them in that arm. But if the majority of them didn't actually get the intervention, you're seeing that you're diluting out your signal, basically, because most of them didn't actually get the colonoscopy, even though they're being counted in the colonoscopy arm. So there's a sub-analysis we can do, which is called an on-treatment analysis, who actually got the treatment. But from a clinical trials perspective, we're obligated to report both of those, because that's the arm they were assigned to. So you don't want to introduce bias, because maybe the people that didn't end up actually getting the colonoscopy, there's a reason, there's something different about those people. And so you don't want to just automatically exclude them when you're reporting the results. To be kind of a purist, you really want to report the people who got assigned and the people who actually got the treatment. So report both types of analyses. But unfortunate thing about that is it confuses people, and it confuses the message of whether colonoscopies work or not. So for me, looking at the study and looking at all of the data, I'm very convinced that colonoscopies are an effective way to pick up cancers. And I hope that that's the message that people walk away with.
I'm going to get back to colon cancer here in a quick second, but one question that pops into my mind with this example and this headline being taken away and the pandemic with a lot of the kind of misinterpreted CDC guidelines, is there a bit of a reckoning in the scientific community about public communication? Is there something ongoing about that right now?
I think it's been one of the biggest challenges, and I think it's still one of those things that we're struggling with in the scientific community, because on one hand, you want to be fully transparent, and you want to put all the results out there, and you want to give people everything, all the information, so that they can process it. But on the other hand, that sometimes confuses people. It can sometimes create conflicting messages, because as a scientist, when we have our conferences, our meetings, when we look at scientific data, these nuances we often spend hours and days and weeks discussing and grappling with. But when you put it out there into the public eye, it can really confuse people to misunderstand what the actual intention or takeaway from the study is. So transparency is kind of on one end of the spectrum, and on the other end of the spectrum is having a clear, concise, succinct, and easy to understand message. And I think that's the struggle we're having as scientists, is where do we lie along that, especially as science continues to evolve. So that's the other variable, is that the truth changes. And what we know to be the truth changes as the virus changes, or as behavior changes, or as something new happens. So I'm hopeful that the pandemic has taught us some valuable lessons as to how to communicate some of that information. But I worry that it has created a little bit of a gap, a trust gap, between the community and the scientific community, where a lot of scientists and experts are sometimes not taken for face value because of some of these issues with how they've communicated in the past.
By the way, to be clear, I'm a meteorologist, so I grapple with the same issue, trying to communicate some relatively complicated
Right.
scientific things out to the public, and how that's interpreted can vary. Back over to the colon cancer and the primary thing. So clearly your recommendation is to get your colonoscopy. There's no doubt that it saves lives. And you mentioned the starting age may move down to 45 years old. In some cases, it may lower. What else should we do to think about preventative action when it comes to colon cancer?
So, there are other tests in between those colonoscopies. So there's a fecal occult blood test, which is generally a card, and you just take a piece of stool and you just kind of wipe it onto the card. And essentially what it's looking for is blood in the stool. Because if you've got a mass that's, growing in the wall of the colon and eating into the wall, it can sometimes leak microscopic amounts of blood into your stool. We really shouldn't be having blood in our stool. Now, the advantage of that is that you can do it easily at home. It's non-invasive and it's quick to do. You can do it once a year. The disadvantage of that, it's very non-specific. So you could have some hemorrhoids, for example, and as the stool is coming out of your rectum, they could rub against the hemorrhoids and get a little bit of blood on them, and that would turn the test positive. So sometimes those tests can be very sensitive at picking up things, but not necessarily very specific. Also, of course, if it's a small cancer that's not yet eroding into the wall or leaking blood into the stool, it may not pick it up as well. So, but talk to your doctor about whether you're somebody who should be doing those at-home screenings in between the colonoscopies. The interval of how often you should be getting the colonoscopies really depends on your first one. It depends on how clean it was, it depends on your risk factors, and it depends on whether you had any polyps or anything else. Ryan Reynolds just got his colonoscopy at a young age on television, and they found some polyps. And
Did
so
he have a history, or was there a reason he did it, just for awareness?
awareness, yeah.
Good for him.
Yeah. And so I think the more of us that really start embracing and empowering each other to do it, and making sure we hold our family members accountable to get their screenings on time, because screening is one of the things that always falls in the cracks in our busy lives when we're running around taking care of everything else. But prevention is so much better than cure when it comes to colon cancer. Now, of course, healthy lifestyle, physical activity, not smoking, limiting your alcohol use, making sure that you're eating a high fiber diet, all of those are factors as well that can really contribute to reducing your risk of colon cancer.
I guess that was going to lead to my final question, which is diet. You mentioned that the high fiber diet is key. What sorts of things should we be eating to generally try and reduce the risk for colon cancer?
Actually, for most things, high fiber diet is good, even for heart disease, because it reduces your LDL cholesterol, which is the bad cholesterol. So I say you want to make sure every single plate looks the same, and a quarter of it should be like a lean protein, chicken or fish or tofu. A quarter of it should be a whole grain. And then half of that plate should be fruits or vegetables. And that should be at every single meal. So when we're talking about breakfast, we need to eat lots and lots of fruits in the morning. We can eat a little bit of oatmeal if we want, a little bit of protein, maybe some scrambled eggs or something. When we're talking about lunch, we could have a salad with a little salmon on it, perhaps a few nuts, something like that. But if you make that an effort at every meal, so you make sure that you have that distribution of food, you make sure you're not eating too much food, and you make sure there's lots of colors on your food. And I mean real colors, not Cheetos or Skittles or some of the other things that...
Not Twizzlers. No. They're colorful.
They're colorful. That's not the colors I'm talking about. Bell peppers and spinach and tomatoes and corn and all of those colors. And so you want to try to enrich as many colors on your plate as possible. Stay away from the processed food. Processed food is not healthy for your heart. It's not healthy for your GI tract, your colon, all of those things. So anything that comes out of a bag, you really want to be thoughtful whether or not consuming it, or even a box. Those TV dinners and such are easy to do, but full of sodium and full of preservatives and other such things that can really increase your risk for many downstream health problems.
A lot of great info there. Dr. Kohli, I always feel like I learn a bunch of different things from you, but thank you so much for debunking that headline and giving us a bit more information about colon cancer specifically. So thanks so much for your time.
Thank you, Chris.